It is most oldest disease in the world. Everybody, whether we are having depression or we are not having depression, everybody should learn about depression disease. It give answer to our many questions about psychology, about people understanding the probability of depression disease in any part of the world is around 10%. We can say that the most prevalent disease in the world is depression disease. We should learn depression disease. It is a good mental exercise too. There is nothing hard in the world. If we know something, that is easy, and if we don't know anything, that is difficult. Most of the time, people are having depression, but they feel difficulty to recognize that they suffered lot. We should learn depression before it comes to our surrounding, before it comes to our family. Many family disputes, many divorce are the result of depression disease. When we learn about depression disease, it also affect our EQ. It will increase emotional quotient of anyone who not having depression disease too. So it is very much required to know about depression disease. In initial understanding about depression, when people learn about the symptom of depression, they start to think that they are having depression disease because it is it looks like that everyone has having depression. But if we deeply understand about the depression disease, we will realize the difference between the person who are having depression and who are not having depression. There are many symptoms are given in the net and many literature, but just knowing the symptoms is not the easy to understand depression disease. It is a little bit tricky, and we should learn depression just like a game. As we play many games, so we should take it as a game. It is just a problem and we have to solve it. And when you will when you will understand depression a little bit, you will really enjoy it. Depression doesn't mean sadness. Sadness is just the emotion, and depression is the disease. So there is a big difference between sadness and depression. The most important reason Why the people don't try to understand the depression is that they think that depression means sadness, and then they drop that idea to learn about the depression. Depression doesn't mean sadness. Sadness is just a symptom of depression, but sadness and depression are two different things, and this is very much needed to make them clear. Depression is the disease, and sadness is the emotion. We will not define many names of depression. I will not say disorder about depression disorder. It is just we are using common man language. That's why we are using depression disease. In technical term, it is called depression disorder. But there is no need to make anybody confused between disorder, risk factor, disease, whatever. Something is disturbed and we have to solve it. Just all. So let me tell you some positive thing about the depression. As I have said that there are 10% of population which affected by this disease. So positive part in this fact that 10% are having this disease is that you are not alone in this world who are having this disease. There are many, many people in this world who suffered from the disease. Now, second important fact, many people who suffered from depression disease come out from this disease without any medicine, without any doctor, without any clinical psychologist, just using their self defense system. Many people require psychologist, psychiatrist, medicine, but many, about 50 60 people come out from the depression by their own. So, this is the second positive part. Don't take it as a if, hard. Uh, there are 50 to 60% people who are suffering from depression come out without any medicine, without any treatment, by their learning. So there are four ways to overcome the depression. The first, the most important, is the cognition behavior therapy. Cognition behavior therapy, CBT. There are many videos about CBTs are available on YouTube. I will tell you simple trick to use CBT. The second treatment available for the depression disease is the medicine. If CBT and other treatment doesn't work, then medicine is required. Third treatment is balanced diet, which is the most important part in the treatment of depression disease. I will explain about the role of balanced diet in the treatment of depression disease. And the fourth one is the understanding depression disease. Yeah, it is very, very important to understand the depression disease very carefully because the symptom of depression are many. And most of the time, those people suffer from depression come with the different symptoms. So it is necessary to understand the depression disease, the cause of depression disease. Because when we understand the depression disease carefully, we can come for the treatment as early as possible. And when we come for the treatment, then we can get the treatment easily, as the other with other diseases, or as with these diseases. If we come late, complication arises. So it is very much needed that we should learn about the depression disease, and this will make CBT easy to understanding. Depression is very necessary. So you can ask a question about health or depression, whatever you like. Depression disease can be learned in very simple way. We have to think like a game. So we have tell that there are many symptoms or diseases, depression diseases. We will explain some of them. A main cause of insomnia, means sleep disturbance, is the depression. The main cause of addiction is the depression disease. The main cause of many diseases which are not diagnosed properly. There are many aspects of depression disease, and we should learn about them. One symptom, one symptom can represent many diseases. If you are having any symptom, it doesn't mean directly that you are having certain diseases. For example, if you are suffered from fever, it may be due to viral infection, it may be due to bacterial infection, fever can be due to any parasitic infection, or many other reason. So keep it in mind that a symptom, single symptom, can represent many diseases. As in the case of depression disease, if you are having a feeling sadness, it may be due to the depression disease. Sadness may be due to the normal physiological changes, normal event. Sadness may be due to other diseases too, because every disease will give you sadness, not happiness. So keep in mind there are more than 100 symptom of diseases, 100 disease, depression disease. Sometimes symptom does not represent any disease. For example, if you are sweating, it may be due to the heavy summer, or heavy sweating may be due to the cardiovascular heart attack. Heavy sweating may be due to the your gastric pain, and heavy sweating may be due to the withdrawal of brown sugar. Here what we have seen, that heavy sweating may be due to many reasons, and in depression, sweating also occur when anxiety is also there. So one symptom can represent a disease, many diseases, and sometimes it does not represent disease. It is a physiological change. So this concept has to be learned because when we know the symptom of the depression disease, it will look like that we are having that disease. That's why it is important to learn this concept. So there are four type of symptom in the depression disease. The first important one, in our feeling, that is in our emotion. If there is a change in our feeling and emotion, or if we are having different feelings or different symptoms, different emotions comparing to the other. Second type of symptom in depression disease is in our thoughts. If there is a change in our thought, or our thought is somewhat different from others. Third type of symptoms are in our behavior, what we talk, what we behave, in our action. So, and the fourth symptoms are, four type of symptom are somatic symptom, like anorexia, or weight loss, insomnia, backache, headache, are all may be symptom of depression disease. Now it is looking like somewhat complicated, but it is not so. I, I will make it easy for you so that you can make video game on this disease. It is really a new concept, and it will be helpful for many people in the world. The video game which are helping to the many people in the world, and people will enjoy too. But we have to understand first what are the basic concepts. So, as I have told, there are many symptoms. I don't want to make you confuse. The four type of symptom I have told you. Now I will tell some few fact which should be remembered to diagnose depression disease. The first important fact is that the symptom should be for at least 15 days. That point has to be keep in the mind. Any depression symptom, if it is for more than 15 days, then it will be considered as a symptom of depression. Just keep this in the mind. 15-day criteria is very important. Second, the symptom should be present nearly everywhere. Mean it should be available, it should be present in the school, it should be present in the home, it should be present in the surrounding, neighbor surrounding, or in a playground. Then and then only it will be considered as symptom of depression. So Keep it in mind. First criteria is that it should be must from 15 days. Second, it should be everywhere, with friends, with parents, with schools, everywhere. Third thing is that, third fact about the symptom of depression is that it should be more than the present more than 80% of a day. Sometimes feel okay, but 80% of time the symptom should be present. So these three things are most important. Some less important are it should be present maximum at the morning time. So these are the some things. Now we will understand why really it doesn't occur. Sometime in the depression, some people have long sleep, or some people have lost sleep. Some people 1 or 2 hour sleep, or some are sleeping for 10 to 14 hours. So some people eat more in depression, some people eat less in depression. Some people lose their weight, some people don't lose their weight, some people gain their weight. Some people are more active in the depression. Sometimes some people feeling difficulty in concentrating, or some people have no problem in concentrating. So why this different pattern of the symptoms comes in depression, we should learn. As we know that human beings are also animals. So basic, there are, if we are in danger, or if any animal is in danger, there are four reflexes, four responses. First, fight. Second, flight. Third, unresponsive. Fourth, be friendly. So symptom of depression also come in this four pattern. Some people overactive, overthinking start, is a fight response. Some people feel difficulty in concentrating, difficulty in sleeping, uh, flight response. Some people no change in concentration, no change in appetite, be friendly, be unresponsive. So that's why four different type of symptoms comes in depression disease. It is just our response, how we respond in the difficult situation, difficult feeling. So you can ask any question about the depression disease, or any about health related issue. Today we are discussing about the depression disease. So we will talk about the first and the most important symptom of depression disease is the early morning awakening. Early morning awakening is the most important symptom of depression, which everybody should understand. Normal sleep is around 6 to 10 hours. If there is a reduction in the sleep by 2 to 3 hours, and this reduction in the sleep for 15 to 20 days is considered as a symptom of depression disease. See, those who are having sleep around 6 to 7 hour, if there is a reduction of 1 or 2 hour in their sleep, then it will call as a depression disease symptom. If somebody sleep for 10 hours, then for those people 3 to 4 hour reduction the sleep will be the symptom of depression disease. But if there is a reduction in the sleep for 2 hours for 3 to 4 days, doesn't mean depression disease symptom. So first, early morning awakening is the first and the most important sign of depression disease, which is present, which is more specific. And here, now second, insomnia. The main cause of insomnia in the world is depression disease. So if you take only the treatment of insomnia, it will not going to be profitable for you. You have to take treatment for the depression disease too. So next is extra sleep, oversleep. Those who people take long sleep for 11 to 14 hours in a day, daily for more than 15 days, is also a symptom of depression disease. So there we have studied three symptoms which are related to the sleep. First one was early morning awakening. Second one was the insomnia, and third one is the long sleep. So now we come to the next symptom, and the symptom is sadness. As we have told that symptoms should be for at least 15 days. If sadness is a symptom and it is present for 15 days, then it will be considered as a symptom of depression disease. Is a symptom is present everywhere. If the people are feeling, if the person is feeling of a sadness feeling with friends, with parents, with office member, means sadness is present everywhere, then it will be considered as symptom of depression disease. If sadness is started by any small events, whether it is a small one or big one, it is considered as a symptom of depression disease. So five fact we should know how to direct the symptom that are going to be called as a symptom of depression. First, 15 days. Second, it should be present more than 80% of the time. Third one, it should be it should be present everywhere. Fourth one, it should be on very small event or very big event. It should be present in small events or big events. Big problem or small problem, same response. So these are the criteria. Second symptom of depression is extra guilt feeling. Something we can do, something we can't do. Something we have done with very perfection, but results are not always according to us. When people started to think that they are responsible for everything, the things which are not in their hand, things which nobody can do. For that things, people are believing and feeling emotion that they are responsible for that, and feeling extra guilt is the, and is the extra guilt is for more than 15 days, then it may be the symptoms of depression disease. One more thing we should know about the depression is that only one symptom is present with depression disease will not going to direct us to say that they are having depression disease. Symptom must be 3 to 4 symptoms should be present if we have depression disease. So, and second important thing is that every symptoms, there are many symptoms in the depression disease, and there is no certainty that every symptom should be present then we call as a depression disease. Only 3 to 4 symptoms are present, then it may direct us to that, say that we are having depression. Keep it in this mind. Depression and madness are not the same disease. They are totally different things. Keep it in this mind. Many people having this disease, depression disease, for more than 50 to 60 years, people find difficult to recognize that they are having any disease. Even the person doesn't able to understand that he or she is having disease. So there is no need to suffer this type of diseases. If we learn this disease, we can understand this disease. The main cause of any addiction, whether it is alcohol, whether it is cigarette smoking, ganja smoking, brown sugar, cocaine, all all addiction is due to depression disease. See, there is a bit difference between addiction and use of alcohol. When we take alcohol weekly, or when we take alcohol one or two times weekly in low amount, doesn't consider addiction. It is called as just use of alcohol. When anybody take alcohol in large amount as a daily basis and feel difficulties in dropping the alcohol, called as addiction of alcohol. And alcohol addiction is due to depression disease. So if anybody want to get rid of alcohol addiction, he should learn depression disease. He or she can learn depression disease by taking some alcohol. We have to drop down the amount of alcohol, and for this we have to learn depression disease and talk about the depression disease. What's going to be wrong? Just talk, nothing. That's very easy work. Just go and talk and talk and talk about the depression disease, and we will get the good response in the low amount. You get that hike in the low amount. When I joined the Osho camp, they have told me a very good point about the addiction. When anybody take alcohol, he should feel enjoyment more and realize and should create the enjoyment, feel the happiness of the alcohol or any disease, any um, substance use. So it is necessary to understand depression disease if we want to get rid of any addiction. We there are many ways in which we can overcome the depression disease. That's our CBT. cognition behavior therapy. Second one is medicine. Third one is balanced diet. And fourth is understanding depression. We have talked about the understanding depression. That was the first part. Now we will understand about the balanced diet. About the medicine, we should know few things, that if there is a need of medicine, then medicine should be, we should take medicine for at least 6 to 12 months, or sometime we have to take it for 5 to 10 years, depend upon the severity of depression. So as we have told that there are 10% of people who have that disease. Some people come out from the disease by their own, without any medicine or without any doctor help or any psychological help. Some people require little bit of treatment, like cognition behavior therapy, or some balanced diet and some other exercise. If depression is not managed uh, by the balanced diet or cognition behavior therapy, then doctor start medicine. So every depression is not the same. Some people have mild depression, some people have moderate depression, some people have major depression disorder. So when depression is major depression disorder, and it is for many days or many months or many years, it require medical treatment, medicine treatment. For some people, medicine is given for initial days for 3 to 6 months with cognition behavior therapy. For some people, cognition behavior therapy doesn't work, only they have to take medicine. So, first, most important part in the depression disease is that we should understand that we can have this disease at any point of our life. People uh, take a very long time to believe that they are having this disease, and that's why the treatment become so hard. So is there any question? So we are ending this live stream, and have a nice day. Thank you very much.